Continuing our discussion on breast cancer, it being Breast Cancer Awareness Month, Dr. Laura Lawson in the lovely hot pink joins me now. She is the medical director at St. Thomas Health Services Breast Program. Welcome. Glad you could be here today.
Great. Thank you for having me.
Let's talk about the mission of your program that you're the director of at St. Thomas. We talked to Davisha previously about some disparities in care and access to care. Let's talk to you about your mission and how to reduce these deadly cases of breast cancer, the ones that aren't diagnosed early.
All right. Well, as part of that, we wanted to be a leader in breast cancer care and currently have one of the largest breast cancer programs in the state. Actually, about a fourth of all breast cancers diagnosed or treated in the state of Tennessee happen at one of our St. Thomas hospitals. So we've really been able to extend our reach and include as many women as possible in that early diagnosis and treatment. And it was mentioned previously, some places have a lack of access, so we actually have a mobile mammography unit that can go to different counties that they otherwise wouldn't have access. We've paired with a lot of large corporations that will actually just have the bus pull up in their parking lot, and then all those employees can get their mammograms done while they're already there, and then they don't have to worry about transportation and childcare. They can go ahead and get that imaging done, and then all of that comes back to our main breast center.
You mentioned before we started taping about early detection and staging of breast cancer and the importance of getting it early, obviously. Let's talk about that, the staging.
Sure. First of all, I think one of the common misconceptions, and that was touched on earlier as well, is that breast cancer is an awful, horrible death sentence and that there's no way around it. And actually that is pretty much a 180 from the truth. The vast majority of cases are diagnosed at early stage 0, which is kind of precancer cells, or stage 1. And really for stage 0 and stage 1, the 5-year survival is close to 100%.
Wow.
For stage 2, the 5-year survival is over 90%. And even for stage 3, which is either a bigger tumor or with several lymph nodes involved, 5-year survival is close to 75%. So really, the vast majority of women do well. They have their treatment, and then they go on about their lives.
So there's a lot of hope out there. It's finding it early, and you also said oftentimes the lumps are benign. It's not cancer. What about women having lumpy breasts? That doesn't mean they're going to have breast cancer.
That's right. Especially younger women, I think they aren't aware that normal breast tissue is lumpy and bumpy and rubbery, and so that's just a normal situation. And sometimes I think women are afraid to do a self-exam because they're worried that if they do it, they might find the lump that is the awful thing, and then it's all over. When in actuality, we really just want women to be aware of what's normal for them, and so that if something changes, then they can be aware of it, maybe wait through a menstrual cycle, because oftentimes that has a lot of interaction with the breast tissue, and a lot of things go away after a menstrual cycle. And then if something persists, that's something reasonable then for them to talk to their provider about. They might need to have some imaging done, they might need a referral. And I think part of the other problem is women only hear about breast cancer. So either there's nothing going on or it's breast cancer, but they don't realize that there are lots of benign things that are probably more common. Actually, I mean, the average lump and bump is more likely to be benign than it is cancer.
I know personally, I was called back for a second mammogram once, and of course I was scared to death,
Right.
but it had resolved itself, it went away. So that's a perfect example of a case where it was nothing.
Right.
But it's a little scary for those moments that you're waiting for the next one. What is the age to begin having mammograms, the standard?
Well, that is a source of some debate these days, but at St. Thomas we're really still encouraging women to start at 40 and then to get one every year. And if a woman has a family history, sometimes they might need to start a little bit earlier than 40. We usually recommend starting about 10 years before the youngest age that a family member was diagnosed. And then we usually will encourage women to keep getting mammograms, because certainly being female and getting older increases your risk. So older women are at increased risk. So those are the very people that we want to get a mammogram, not for them to say, oh, I'm too old, I don't need one. They really need to keep coming. So as long as they are mentally and physically healthy and able to get to the place to have the mammogram, then they probably ought to keep doing it.
If someone has, let's say someone doesn't find a lump, but maybe there's some other change in the breast, can you go over what some of those other symptoms might be that something's going on?
Sure. Sometimes it's more of a thickening. We see a lot of it's kind of redness, those sorts of things. When in actuality, it's probably more likely to be a rash than it is anything else, or just some dermatitis, a skin thing more than a breast abnormality. Nipple discharge, that is oftentimes listed as something to be aware of, but the vast majority of those cases are benign as well. So really, it's almost more of just a change from what women normally are seeing and finding. And we'd always rather women come in and have something checked out than be at home worrying about it, because we can usually figure it out pretty quickly and put people's minds at ease so they can go on and do other things and not sit home worrying.
Err on the side of caution.
Exactly.
We know there's a Crucial Catch, a campaign coming up, a program that you are doing with, I believe, with the Titans.
Yes.
Can you talk about that? That's going on this month.
Yes.
In October.
Actually, the ball game on the 16th is the breast cancer awareness game, and the NFL always promotes the wearing of pink with the players, but we do a special event and actually have survivors that have a whole special day. We start out at the Titans practice facility, and then they're brought to the stadium, and they're really treated to a special day. They're down on the field at the beginning of the game, and oftentimes get to meet players and just be part of that whole atmosphere, are recognized as survivors.
Great.
And then we get to stay and cheer on the Titans.
Terrific. Okay. Thank you so much, Dr. Lawson, for all that you do.
Oh, my pleasure.
Yes.
Thank you for having me.
And the event is October 16th, and we will be right back with more after this.